The North Nibley Romania Team has been working in Eastern Europe for more than 2 decades.
The date of the trip is 10th of July to 24th of July.
It was formed by members of North Nibley Congregational Church in Gloucestershire in 1990, following the horrific scenes shown on television news of the conditions in many of Romania's institutions. The NNRT is one of a small number of British charities still working in Romania. Fundraising goes on all year round, and all the money raised goes directly to the charity, and it focuses its efforts in the remote village of Mina Una Mai. The name Mina Una Mai means Mine of the 1st of May, and until the 1960s the village was a prosperous coal mining community. Fortunes changed when the coal ran out, and the mine was closed. The building which housed the mining company was pressed into use as a psychiatric hospital, which is now home to around 150 long-term adult patients.
Este situat în clădirea fostei administrații a unei mine, care pe parcursul timpului a suferit diverse modificări, ajungând să fie folosită în ultimă instanță ca un spital de psihiatrie. Dar aici au fost niște birouri și pe parcursul timpului s-a reamenajat.
The mining buildings now constitute the hospital. The hospital is a psychiatric hospital housing chronic patients, basically with anything and everything wrong with them that cannot be cured. These patients are here for life. As such, they tend to be forgotten.
It's got about 150 patients at the moment, all psychiatric patients, some with physical disabilities, but mainly mental disabilities.
We feel that while they're here, we should make their life a little bit more comfortable, and this is really what our aim is in this village, in this community. We maintain the hospital grounds, we maintain the hospital buildings, and we try to maintain the care of the patients as much as possible without taking over from the hospital. We're here to assist rather than to actually do it for them. When we arrived in this village about 10 years ago, I suppose now, things were dire. Patients didn't have much clothing, didn't have an awful lot to eat. There was as much as 3 patients to a bed. The beds were basically welded rods on an iron framework.
There are very large wards as opposed to the small wards we have in English hospitals. They're very sparsely furnished, and the patients have no personal space whatsoever. The beds are pushed up close up to each other. They don't have little lockers, and the wards are pretty dingy.
The most shocking aspect of that hospital for me, as a nurse, is the degrading conditions that the patients live in. The wards are just appalling. Beds side by side, no lockers, no curtains, no privacy. I've even seen a dead person there, just with people crowding round and no respect whatsoever. And that for me is terrible.
The condition of the patients have been very much, some are very mentally disturbed. There are several, or many of them are schizophrenic. The medicines they've had have been poor in the past, but over the last few years with the involvement in charity and the authorities there, the medicines are better, the patients are improving, but still not again to a level that you'd expect from a modern Western country. To someone who's never been to that hospital, the first perception would be that it's not a hospital, that it's just a building that people have been put in to live in to really see their life out. But it is good, the staff are improving there. They are starting to look after them far better than they used to. But I have to say, from my personal point of view, it's not the sort of place you'd want to stay in, but I think we're making massive improvements to make it a lot better place for people to be there.
It's the noise that struck me. Probably the smell as well, but I think it's the noise and the crowds of patients that are just keen to meet you and talk with you and hold your hand or show you things.
I'd had an idea, people had told me what to expect with regard to how the patients looked and the way they slept. You know, the beds weren't very brilliant, some of them didn't have mattresses and things like that, and some of the patients didn't have shoes. But what hit me most was a strange smell mixture of sort of cabbage and sweat and the dankness of the hospital. It was very dark.
Can you imagine walking into a dull room that smells not very nice? It's very hard to describe the smell. A hatchway opens in the wall and a large bucket or a cauldron of something is passed through to the staff on the other side. Patients then, clutching something like a plastic butter dish or any container that can hold liquid, they will fight their way to the front of the queue, and somebody from the kitchen with a ladle will then fill their container and give them a lump of bread. Basically that's their mealtime. The food is not bad food. It's very well prepared by caring staff. It's catering on a large scale with a very, very low budget. That means there's lots of potatoes, lots of pasta, and maybe a little meat, maybe a few vegetables, maybe a little bit of onions, but it depends on what they've got in the larder at that time.
I think the best thing we ever did was when we renovated the kitchen.
Very dark, dirty kitchen. They've got this huge gas range which pumps out a lot of, it's a wood range now, and it pumps out a lot of smoke and dirt. And these great cauldrons of boiling fatty foods that they boil up for the patients. And it was very dirty and very run down.
Run down, it was dilapidated, the walls were crumbling. It wasn't very hygienic. The kitchen equipment was outdated. And in 2 weeks, we transformed it into a decent working kitchen.
We cleared all the walls off of the old dirty tiles, ripped off the old sinks, completely painted the kitchen and retiled it. So what we were able to do is provide a clean, tidy, easily cleaned kitchen.
Patients were getting decent food, well prepared, in, as I said before, hygienic circumstances. The crowning bit of the charity up to now was the renovation of the doctor's surgery down in the village.
The 2007 survey team found the building was in a poor state of repair, with damp on the walls and a number of structural faults. It is an important part of the village, with a GP visiting regularly to hold surgeries and to monitor the health of babies and young children.
Well, we took a dilapidated building, and in 3 weeks we transformed that into an up-to-date doctor's surgery. It's benefited the village because they now get doctors going every week. Sometimes 2 doctors go, whereas before there was just spasmodic visits once a month by a doctor.
Material things, apart from clothing and food, we've supplied building maintenance. Perhaps that's the easiest thing for us to survive, because we've got a wealth of expertise, certainly in the building trade and engineering trades. We supply maintenance to washing machines, spin dryers. We've supplied lighting in the hospital. We've decorated wards. We've decorated corridors. We've repaired broken steps. Anything that gets broken, we tend to repair it or replace it.
During the past 2 decades, the team has also worked at the primary school, improving the safety of the electrical supply and providing running water to the building.
La școală și la grădiniță sunt 113 copii, dintre care 40 la grădiniță cu vârsta cuprinsă între 3 și 6 ani și restul la școală cu vârsta cuprinsă între 7 și 11 ani. Această organizație a făcut foarte multe pentru școala noastră. În primul rând, au introdus apa potabilă în școală, au schimbat instalația electrică, a dotat școala cu fosă septică și cu instalații sanitare, grupuri sanitare, a donat mobilier nou, a schimbat parchetul, a zugrăvit școala în interior, în exterior, a construit un magazie pentru depozitarea lemnelor, s-a construit și montat o poartă nouă. Printre alte lucruri făcute, au donat și jucării și materiale necesare desfășurării activității didactice. Această organizație a schimbat viața elevilor și a cadrelor didactice în bine, deoarece tot ce s-a făcut a ajutat la buna desfășurare a activităților atât a cadrelor didactice și elevilor, cât și a personalului auxiliar din școală.
In recent years, the team has funded a dentist who regularly visits and uses a dental surgery at the hospital. Before this, dental treatment for the patients was very limited and sometimes required them to be taken from the hospital to another surgery.
I would say when I first went there, I would describe the hospital as 50 years behind times when we first went there. But now it's changed. It's coming up together. We're proud of what we've done. And it's a pleasure to work with the people out there. And when you walk away, you feel satisfied.
In 2009, the North Nibley Romania Team, along with a charity from Holland, helped with the construction of a new occupational therapy room. It is designed to encourage patients to take part in craft activities like weaving, sewing, knitting and tapestry.
După 1989 s-au produs multe modificări, sperăm noi în bine, atât în îngrijirea pacienților cât și în spital. Mă voi referi la început la modificările spitalului, ale clădirii, în sensul că am încercat să ne apropiem mai mult de Occident, de ceea ce am văzut noi pe la televizor sau am citit și cum ne-am fi dorit noi să fie. Am făcut saloane mai mici, am încercat să creăm un confort pacienților, fiecare salon de câteva paturi să aibă o baie, să asigurăm un circuit igienic corespunzător alimentelor și tot ceea ce ține de îmbunătățirea condițiilor pacienților.
Things have got better in the hospital, yes, they have. And I think a lot of that is down to not only our charity, but several other charities that work out there.
The conditions now are improved, but they're still not good. They've gone from, when I first went out, more than one person in a bed, to at least they're now all in individual beds, in wards that are more respectable. I still wouldn't say it's a place I'd want to live in or want to be in as a hospital, but the conditions are improving for the patients there.
I do think there is a need for the charity to continue in the future. I'm not sure that we can actually improve the way the patients are cared for because, for one thing, we don't have the caring staff in the charity anymore, but we can do an awful lot of building work as we have done in the past. There's always something that needs doing.
Day after day it's the same there, and if we can just improve the conditions, give them a few presents now and again, show them a bit of love, it brings something into their lives which is definitely missing.
I have made lots of friendships. In fact, I think everybody in the charity has. Lots of friends in the village, lots of friendships with nurses and doctors. One doctor I keep in touch with all the time now by email. And lots of friendships with the patients because some of the patients have been there so long and they recognise us when we go back, know us by name, and it is very rewarding.
It made me a better person and it made me more, I felt more for people by doing it. It was lovely, lovely experience.
It's very rewarding. It's great because we know the people as individuals, that the money and the efforts that we put in and the changes we make, we know that the people that has an effect on. And if you're going to go out there particularly, it's fantastic to actually be with the patients and get to know them. And they just never leave your heart then.
It's the pure love on the faces of the people in the hospital when you show love to them. Their warmth is incredible and it's worth every ounce of energy and money you spend on doing this.
I think the future of the charity that we've got here is that we've got a lot of friends in the village, in the hospital, and we will continue to give whatever's necessary to make their lives better, to offer future growth for the patients, for the community there. But our involvement, I think, will continue to be there while there is a need for us.
There's a great spirit amongst the team Everybody's there to do what they can for the people of the village and for the hospital. And we all muck in together, we all eat together, we all have a good time together. Sometimes we work pretty hard, and sometimes we have a good laugh at the end of the day. So really, all round, it's just a brilliant, very fulfilling experience.
I think working with the people out there in the village and the hospital have been so enlightening to me. When I first went out there, I was very nervous, very scared. I had no idea what I was walking into. Within the first year, that fear had gone. I'd fallen in love with the people there, with the village, with the patients, and you form a friendship with them. The patients may not know who you are, but they do know once you get out there that you're on their side, you're there to help them. And I've made amazing friends with some of the patients and the villagers as well. There are various people out there who've helped us as the charity, and they make you part of that village as well. And it's somewhere that you're not just going back to help someone, you're going back there because you want to go back, because you feel part of that community. And that's been the massive thing for me as well. Not just there to help the patients, you're part of the community and you want to go back.